So today we are going to be talking about heart health and how nutrition plays a role. I am Stacey Ring and I'm the founder of Real Nutrition Kitchen. I will let you guys know that you can always, I have my chat up, so if you have questions, feel free to pop it in the chat and I'll either answer as I go or if I'm rolling, I save time at the end to make sure I answer questions for you guys. So like I said, I'm Stacy. I am a clinical nutritionist. I have my bachelor's and master's in nutrition. I've been in the health and nutrition industry for a little over 10 years. I started as an athlete and my passion just grew from there. I worked from health coaching, weight loss coaching into nutrition consulting. Now, as a clinical nutritionist, I like to focus on functional approaches and looking at the body as a whole. So we'll be going over that a little bit today as we're talking about heart health. What is heart health? So heart health and what I'll be talking about today is our cardiovascular system, which is the system that's pumping blood and oxygen throughout our body. So it's really important. Some labs that you guys may be familiar with that's correlated with your heart health are our cholesterol panel. So that's your LDL, HDL, total cholesterol, and triglycerides. Your CRP, so your C-reactive protein could be correlated with your heart health, blood pressure, and even weight. So if any of those are a little wonky, you are in a good place. Common symptoms of maybe some poor heart health that's going on, or maybe that your cardiovascular system could use a little attention, is if that you have a shortness of breath with everyday movement. So this is you moving around the house, going up your stairs, going out to get your mail. If you're winded from just the everyday movements, not exercising, that could be a sign that there's some stress on your heart. If you have brain fog or difficulty concentrating, so this is something some people don't think of that correlates with your heart health. But if you think about it, your heart and the cardiovascular system is pumping the blood and oxygen throughout your body, and your brain loves blood and oxygen. It helps it think and process. So if we're not getting adequate amount, we are going to have some of that brain fog and difficulty concentrating. You may be experiencing losing weight. Sometimes we see it specifically in the belly fat. I'll be talking about visceral fat today. So sometimes that visceral fat is going to make our heart health a little low. And then if we have high stress, physically, emotionally, just stress overall, and poor recovery time. So I like to tell people you could either heal and repair or you could break down, but you can't do both at the same time, right? So we break down muscles, then we heal and repair and our muscles grow. Same thing for all aspects of our body. If you're breaking down things, you need to let your body heal and repair. So if you're not allowing that to happen, that could cause a lot of stress on your heart. Hello, Kirsten. Hello, Rebecca. I see you guys in the chat. Okay. I'm not going to geek out on you guys science related, but I do want to give my visual learners a little bit visual of what I'm talking about. I'm such a visual learner, so I had to include it. Up here on the left, we have a healthy heart. You can see that the coloring is all normal. There's a healthy amount of fat on it, right? To the right, we have an unhealthy heart. What you see on it is some discoloration, so some darker red here, and the more obvious, the fat that's surrounding it, the visceral fat. So once we get a large amount of this, it makes our heart muscle work really hard to pump. So looking at the cartoon for the coloring, this nice pink is a healthy heart, which we see over here, the nice red pink. A dying muscle or one that's struggling is going to be that darker, more condensed color, which is what we see over here. And then what our heart does is it pumps blood and oxygen through all the veins and arteries in our body. And if we have too high of a fat amount in our body, what you see here is it starts to clog a little bit. And so instead of the blood going through and the oxygen going through, it starts clotting a little bit, which is how you develop the blood clot. So just a little visual of what I'm talking about with heart health. So now, how do we prevent this from happening, right? because we definitely don't want this. Nutrition plays a big role. I know I'm biased because I'm a nutritionist, but I will say it's probably one of the biggest contributing factors to your heart health. So the foods you eat will either keep your heart healthy or it's going to damage it. Quite literally. It's either going to make it healthy or it's damaging it. You don't need to hop on a fad diet and eliminate entire food groups or give up the foods you love to have a healthy heart. So that isn't what this is. This isn't a fad diet or this isn't a pill that you need to take. These are steps that you're going to take consistently over time that's going to promote heart health. So some of the top 4 things that you can do, we'll talk about what you don't want to do in the next slide. So what we do want to do in our diet and in our nutrition is we want to have a variety of quality proteins. So to support a healthy visceral or fat level, we want to make sure we have the key is a variety. So we don't want to eat the same protein every day. And you want to make sure you're getting some lean protein, lean poultry, which is your chicken and your turkeys. You do want some healthy fat-filled seafood, which could be like your salmon, your sardines. Beef is definitely okay, but not if you're having it every day, all day. Bison and wild game. So really the quality of your proteins matter. So if possible, you're going to want to get wild caught seafood. You're going to want to get the pasture raised poultry and wild caught beef if possible. If not, you just want to look at the ratio of the fat content to the foods that you're eating. Now, if you're someone who this is more you're preventing, right? You're not at a level not at a level yet to be concerned of heart diseases, then maybe you don't need to look at every label and see the fat ratio in your beef. But if you are someone who is already at the level where you're struggling with a heart disease or condition, looking at those fat levels and the quality of the protein is going to help. Up next, we want complex carbs and fiber. So complex carbs are going to be the more nutrient dense carbs. Easy examples are sweet potatoes, blueberries. Those are all have high amounts of complex carbs and fiber. These are going to help reduce inflammation throughout the body. And if we have reduced inflammation, we're going to have better blood flow, better oxygen flow, and better nutrient absorption, which is all needed for a healthier cardiovascular system. Quality fats. This is a big one. Some people assume that if you're focusing on heart health or you're struggling with a heart disease, that you want to eliminate fat. And that's not quite the case. We need fat in our diet. We need fat for a lot of things, for hormone regulation. We do need a little fat in our body for protecting. We do need a little bit of visceral fat so that it's surrounding our organs. But the type of fat that we're eating is going to be what plays a big factor. So what you do want to eat is healthy unsaturated fats, like I said earlier, like the salmon, avocado, olive oil, olives, all of those type of unsaturated fatty foods. And then another thing that you want to incorporate is your hydration. Hydration is so important. Our body is made up of water, and if we aren't properly hydrated, we aren't going to get proper circulation and blood flow. So I tell people a good place to start is about half your body weight in ounces of water. If you're not there yet, that's okay. And I wouldn't jump there. Um, Sometimes what I notice with clients or what you may have noticed is you know you need to drink more water. So you start drinking more water, but then you're just going to the bathroom a lot more, right? Your body is not really absorbing that water. So when I say proper hydration, I'm talking about not just getting more water in, but we need to absorb that water through trace minerals in our diet. So if you've heard about the Himalayan pink salt, trace minerals, that's what kind of it does. It's all those minerals and micronutrients that we might be lacking in our diet that are going to go in, clean up our cells for better absorption. So hydration is kind of twofold. You don't want to just drink a bunch of water. You want to make sure you're absorbing it. And that just goes hand in hand, kind of case by case with if you're absorbing your water or not. So for dietary, we want to focus on the quality of our proteins. We want to focus on exchanging for complex carbs and fiber. Another thing that you might notice if you're eating a more energy dense carb item, so sometimes like a bar, it's going to have other ingredients in it that are going to either contribute to the poor heart health. Sometimes there's trans fats in there, or it's going to increase that inflammation. So you really want to focus on just the whole food complex carb. We're going to focus on healthy fats. So if you're just starting, just kind of pay attention to your fats, look at the levels on the ingredients and in the nutrition facts and see what type of fats are in the foods you're eating. You might surprise yourself and have already enough unsaturated fats in it, enough of those omega-3s, right? But you might be getting too much of omega-6s or the inflammatory fats. So if you don't know where to start, just start at the basis and evaluate where you're at with your food. And then, of course, hydration, proper hydration. We want to drink water and make sure our body's absorbing it. All right, I know I talk a lot and I talk fast. So if you have questions, please pop them in the chat and I'll make sure that I am looking at them. Okay, we know what we want our body to have. Now, what might we be doing or eating that is contributing to poor heart health? So these are foods that you're going to want to limit or avoid if possible. Ultra processed foods. We're at a time where I'm not just teaching about whole foods and processed foods, I'm teaching whole foods, processed, and ultra processed foods. So those ultra processed foods are going to be the foods that are high in the trans fats, which the trans fats are what's really going to cause the high amount of visceral fat. So we want to limit those trans fats. We want to, in the processed foods, it's usually high in refined sugar and refined carbs, which our body processes that differently. So that could cause or lead to inflammation or even fat storage. So we really want to limit our ultra processed foods. These are foods most commonly in fast foods, or if you're going down the aisles, they're usually prepackaged foods. Not all prepackaged foods, though, are ultra processed. So it just goes hand in hand with flipping it over, looking at the ingredients list, and seeing if there is any trans fats. So that's my next part. A diet in high trans fats is going to lead to heart disease, and that's just how it is. If you are someone who already has a heart disease or disorder, this is where you want to focus. If you're someone who wants to prevent it, this is where you want to focus first and foremost is how much trans fats you're getting into your diet. When you're looking at the nutrition label, they will tell you specifically how many grams of trans fat. You want to be as close to zero as possible. Like I said, these are specifically the fats that are going to go in and just kind of get stuck. So we want to limit it as much as possible. Another things that correlate with poor heart health is a sedentary lifestyle. So a sedentary lifestyle, it means that you're not really moving a lot. It doesn't even necessarily mean that you're not exercising. It just means in your everyday movement, you're kind of sedentary. You may work a desk job, you may be at home, you may watch TV. What happens when we're sedentary is a lot of things, but the most important thing is blood circulation. And if we don't have that proper blood circulation, we're going to have all those problems that we saw in those first slides. Sedentary lifestyle also increases the risk of a high fat or a higher weight. So we want to make sure that we are living an active lifestyle daily. Doesn't mean you got to go to the gym and lift weights for an hour a day. I'm just meaning maybe take the stairs, park a little further in the parking lot, and walk a little bit more. I love to do morning movement. So first thing when I wake up, I brush my teeth, I do some rebound jumping. Literally just me in one place, jumping up and down. I try to get 50 jumps, and it's motivating your lymphatic system and your blood system to start working and flowing really well. And then stress and sleep. So this is a big contributor to heart health. When we have constant stress in any form, so that can mean constant stress on the body, maybe a physical job, or you're very active, maybe it's how you stress relieve to go and work out a lot. Constant stress in any form is going to decrease heart health. Because, like I said, your body can either be in a heal and repair state or it could be in breakdown mode. So, we have to let our body get into a heal and repair mode to make sure that our body is resetting. Helps with digestion, helps with oxygen flow, helps with everything. So, we're limiting and, if possible, avoiding those ultra processed foods. We're going to limit a high trans fat diet. This may seem like a lot. I would start first with what you have at home. What kind of foods are you cooking with? What kind of fat are you cooking with? Are you cooking with a margarine or a shortening, which is not beneficial for your heart health? Or are you cooking with an avocado oil or a grass-fed butter or a ghee? Those are going to be way better options to cook with. Sometimes what happens too, olive oil is something great to cook with, great omega to 3 omega 6 ratio, great for your everyday diet, not good to cook with. Some oils or some fats have a smoke point. Once they get heated to a certain temperature, they change chemically and they do different things in the body. So, for example, the olive oil, when it gets heated past around 350 degrees, which sometimes we're doing in the ovens, it's gonna chemically change to be a little bit more inflammatory. So just be careful when you're buying, or just be mindful is what I want to say. Know what's going into your body. The olive oil, grass-fed butter, or ghee or tallow is going to be a great option to cook with at home. Okay, so preventive strategies. Like I said, you could be in a place where you're already in a position where your labs are altered. You may have a diagnosis, or your labs may be altered, but you don't have a diagnosis yet. So this could be preventative strategies as well. We want to make sure that we have appropriate amount of fat, protein, and complex carbs. So we talked about our quality of protein, we talked about our quality of fats and quality of carbs. One thing on top of that is we want to make sure we're getting them all. So if you're looking at your diet currently, and you notice that you have a diet that when you're eating your meals, there may not be a source of protein, or it's really high in those trans fats. It's going to make your body not be able to digest and absorb it as well. So when you're making those meals, first just focus on quality of ingredients. Once you got that tackled and you feel confident that you're using good and nutritious things, then focus on building your meal. Do I have some quality protein? Do I have a little bit of quality fat? And do I have some complex carbs? That's what's going to create a balanced meal. That's the goal. And that's why it's not a fad diet. It's a consistent diet over time that is going to make your body happy and healthy. Exercising. This is just a rough estimate. They say research says around 150 minutes per week is beneficial in preventing hypertension. And like I said, this doesn't mean that you need to go to the gym and work out heavy for an hour. Just be more active and be more intentional. Go for a walk. Call a friend and go for a walk with them, or talk with them on the phone while you go for a walk. It makes it go by really quick. You could do stuff inside, pop on a YouTube video. They have so many free workouts on there. It is really easy to get that 150 minutes in if you're just living more of an active lifestyle. Keeping a healthy weight. I don't talk much on weight because everybody is truly individual, and a healthy weight that might be good for someone is not a healthy weight for somebody else in terms of gender, in terms of culture, race. There's so many things that go into our BMI, but just being in a healthy range is going to benefit the strain that is put onto the cardiovascular system. So we're going to manage stress as much as possible. I know this is easier said than done coming from experience, but I really want to challenge you to find a way to manage stress that works for you. Is it waking up and having a cup of tea and journaling? Is it maybe going on a walk is your time to kind of just think things over, maybe put on a podcast. Yoga and meditation are always great, sometimes kind of harder to start with, but great ways to manage stress. I have clients that they like to dance, so they put on their favorite song, and if they're feeling a little overwhelmed or anxious, they're going to dance. It's really anything that works for you to manage your stress. We're going to limit alcohol and, if possible, stop smoking. Those are very detrimental to your heart health, specifically the smoking aspect, too. And then this goes along with the stress and getting your body in healing and repair. We want to get 7 to 9 hours of sleep per night. That may be a little bit different depending on who it is, what you're doing with your lifestyle, and things like that. 7 to 9 hours of uninterrupted good sleep a night. Is there anybody who is not getting 7 to 9 hours of uninterrupted sleep? Yeah, sometimes that's hard, very hard. And there's different contributors to go to that. So that's something you work on, you go through your day and might be able to find something that's preventing you from falling asleep, or staying asleep is usually a hard one. You're waking up throughout the night. So preventing strategies, right? Don't wait till it's too late. Don't wait till you already have a diagnosis. Let's start doing these every day to live that preventative lifestyle. Okay, final thoughts and questions. I'm going to leave you with this, and it might ruffle some feathers, but it's very true. What you eat is directly correlated with your heart health. Heart diseases and disorders can be prevented and, in some cases, reversed through the foods that you eat and the lifestyle you live. Let that sink in. Nutrition and lifestyle play such a powerful role that if you don't know where to start, that's where you should start. If you're on someone who you may feel like it's too late, you've been on medications for years, it's just how it is. Maybe you're a little bit genetically disposed. It has happened in other family members. You can still live a healthier lifestyle and have a healthy heart through diet and lifestyle changes. Any questions? I know I talk a lot and I talk fast. You could pop them in the chat, or you can unmute yourself, and then I'll kind of talk about where to go from here. And I'll start talking, and if questions come up, yes, Rebecca.
Okay, I try to get the sleep at night. I do use a CPAP machine, which helps a lot, but I don't know how to get it up there because when I go to bed, I lay there for a little while to unwind, relax, whatever.
Hmm.
And I also the omega sixes and threes, I'm kind of confused on. I do a whole food plant-based diet, which is lowered my cholesterols and lowered my insulin needs, my A1C, the whole shebang. But I still cannot get my triglycerides down.
Hmm.
Any suggestions on the triglycerides?
Yes and no. I think everybody is, I would love to really see what you eat day to day as a full diet, especially as plant-based, just to make sure we're getting all the macros in. Like I said, if we're not getting enough of that balanced diet, your body doesn't absorb things properly, right? So if you're having higher triglyceride levels, I would definitely look at the ratio of fats you're having, which led to your next question, which is maybe why there's some confusion. So omega-3 to omega-6, we need both of those, right? We need both of those
Right?
types of fat. What happens is sometimes we have an improper balance where that omega-6 starts reaching towards and is in an equal amount of omega-3 or surpasses it. And when that happens, that's when we start having the inflammation and the trans fats, right? So I would make sure that first start at home. What are you cooking with? Make sure you're cooking with a good oil, good fats, and control what you have at home. And then
Hmm.
step out and evaluate how are you eating outside of it. And then check your lifestyle. Make sure you're having that active lifestyle every day. Don't have to work out every day, but just move.
I'm on a walker. I know triglycerides and cholesterol are very high in my family. I'm the
Hmm.
lowest, and I'm nowhere near anywhere near as high as anybody else, but I'm also the only one that's diabetic, which I have because of an autoimmune condition.
One thing I would consider too, Rebecca, and anybody is if you have had a level your entire life or for a good part of your life, and you have genetic dispositions, something I would consider is what is your baseline? What is Rebecca's baseline for triglycerides? And we can see that. We can track that through the years. Has it been fluctuating or has it kind of always been this level? That's something I would consider too.
Pretty much always this level.
Yeah. So one thing to consider is maybe it's genetically disposed that you have a naturally little bit higher of triglyceride level, especially if you have family history. So one thing to consider maybe is watching the trend of it. Let's see how it trends and then go from there.
Okay, thank you.
Yeah, of course. And then I did have someone ask, does taking a 10-minute walk after dinner really help with blood sugar absorption? My primary care doctor recommended it, and I'm seeing a lot of YouTube videos about it. I would say yes. Any type of movement after eating is going to benefit not only the way your body digests it, but how it absorbs it as well. So motion is great. When we're digesting, our intestines are in motion, right? So if we're just sedentary, it makes it kind of a lot harder. Where if we're moving and we're active, it's going to help that digestion. It's going to help absorb a lot better. And that in turn comes with blood sugar absorption as well because of how well we absorb our food. If we're not or if we're not eating a balanced meal, that's going to affect the blood sugar absorption as well. Short answer though, movement after eating is always going to be beneficial for multiple of reasons. Great questions. If there is no more questions, feel free, you can keep asking. Where to go from this? I really wanted you guys to not only learn, but be able to take it and apply it to your own self. I created a heart health assessment. It asks different questions about diet. It's really short, diet and some lifestyle questions. And then it's going to give you a better idea of maybe how your nutrition and lifestyle is affecting your heart health. If you complete this and you want a little just recommendation of something you can start on, I would love to do that for you guys. I'm going to drop in the chat the link to the assessment. I'm also going to email everybody after this a link to the assessment as well. And it's just more for you guys. If you don't want to give it to me, that's okay too. Just know that you can and maybe get a little bit of a starting point of where to go. Let me copy paste. Someone let me know if you guys can see that link I just put in the chat. Perfect. All right. Well, like I said, don't feel overwhelmed. Start with what you control. Start at home. Do this assessment and see where you're at. If you need a little help, let's work together and see where we can get started. Person got the link. Awesome. All right, you guys. Well, if you don't have any more questions for me, it was so lovely to chat with you guys and discuss your heart health. And I look forward to talking with you guys after as well. All right, you guys, have a good day. And check your emails because I'll email you all after to make sure that you get a copy of the recording. And then if you want to do the follow-up assessment.